Recorded all of this, so I remember.
That's okay. So see when she's turned away, and she turns her head to that side. See that bulge that happens right there? And then it disappears right there?
Do it again?
You've got a bulge right there. And as she puts her head back to normal, it's going to disappear right there. So bulge, and then it goes back into the body. So that is the second cervical vertebrae. So some of the equipment that they use for driving has the horse's head in a downwards fixed position, which really isn't so good for their body. They should be able to bend forward and have their neck extended to help them pull into the harnesses. But sometimes they put like check pieces or side reins on them to keep them in a fixed position. And basically what happens is your top line ligament will end up stretching, over flexing to the point where it pulls the vertebrae up out of place. So this vertebrae has lost a little bit of its stability, it's very common, especially in hunter horses as well, that this vertebrae isn't quite in the right position and doesn't quite have the right joint flexibility. So that can all be fixed, but that was where she showed the most pain. And what was happening was when I first pushed here, there was twitching all on her face right here, which usually indicates nerve pain. So I don't know if you've ever hurt like a certain spot of your back, but you get like the sharp firing pains down your leg sometimes.
Yep.
Usually when it's something up in the neck and it causes eye twitching, usually that's what's happening. So the vertebrae may be compressing to the point where they're pinching a nerve when she puts her head into a certain position. So that is something that we can work on down the road when she's able to go under saddle, because there's lots of work that I can give whoever will be riding her to help fix that. But it's just good to know, like she might really come to enjoy just 5 or 10 minutes of rubbing like this when you have her in, right around that area to help bring a little bit of heat back to that area to help reduce the inflammation. So if you have her in the cross ties, just have her head looking straight, and then just flat hand and just rub just like this for about 5 minutes if she'll tolerate it. That's just a fairly simple thing that you can start doing.
So just mostly this side or the other side
You
too?
can do both sides, but it's really this side that she was showing discomfort in. And that can cause some of the head pain that she was showing there. Like she had a lot of tension all around her face and stuff. So basically when anything happens in their body, they'll gather it up behind the ears and into the face. It's kind of the same premise as whiplash, or like if you slip and fall, you usually always stiffen up in the neck. So they hold their center balance and center of gravity in here. So whenever something happens in their body and their body becomes out of joint, and then they start to compensate for it, it almost always concentrates up into the face area, and over a long amount of time it can actually cause like headache pain for them. So it can make it hard, like some horses will train slower because they're constantly battling pain and having a hard time focusing, but she really enjoyed that area being done, as you saw. So in terms of some really simple stretches that you guys can start to do, I do some neck stretches that I usually teach with like carrots or treats, so that they can kind of follow the treat. If you put a treat in front of her face and teach her to follow the muzzle down to the outside of the knee.
Okay.
And back towards the stifle. I don't expect them to be able to touch the stifle, but you just want to aim for it. And as time goes on, like if she can only come to here, as time goes on, maybe 2 or 3 weeks down the road, you should be able to get to like here, and then so on and so forth. See if she can do this one. Okay, so this one is it's a pelvic floor muscle stretch.
Okay.
So there's a spot right next to the top of the tail. There's a little dent where this muscle starts. So you put your fingers right into that dent and just really gently scratch. See the pelvis lift up? Were you able to see that?
I was looking here, but I'm sure that's
Okay.
what's on.
So I'll do it once more. She's even doing it right before I touch her. So I'm just scratching really lightly, and then the back lifts like that. I'm doing it like finger touch lightly. Like usually with horses you can really go in and get them to get a good stretch, but she's so sensitive through there. And that's going to rotate the pelvis. So I think any harder might be painful for her, but if you're just doing it kind of light like that, that'll be fine. Unless you think it's starting to hurt her, like if she's constantly pinning her ears back when you're doing that, or switching the tail, or trying to get away from it, then just leave that one alone, and we'll phase that into her program later. And then we can try basically the same thing under the belly. So I'm going to have 2 hands go under the belly. I'm going to find the middle line of her stomach, and then I'm going to scratch with a little bit of a lift, and it should rise her back up. Just like that.
Yep.
So again, I'm not pushing hard and fast. I'm just slowly scratching it and lifting up. So as long as she feels comfortable with that one, you can add that one in too. So those are similar to doing like sit-ups and crunches. So usually one isn't sufficient, you have to do them in reps. So I like to try to get about 5 or 10 of each done. For her, let's aim to only do 2 of the bum ones. So when you bring her in, if you do the stretching when you first bring her in, and then maybe come in here and walk her around, and then do the stretching again before she goes back out. So just 1 of those each time, and then try for about 5 of the belly ones. So you just give her about a minute in between them, and then, so I usually do it when I'm grooming. So every time I'm grooming near the belly, I'll do the belly one, and usually every time I'm grooming near the bum, I do the bum one, but for her, we'll just stick with like once or twice of the bum one. That's probably about it for now. We can add more stretches in as things improve.
Okay, so no stretching of the legs and stuff.
No, no, because I think if we, like the back legs, we can't stretch the way that they are. And I think if we try to stretch the front legs, she's going to place too much weight on the back legs and probably get uncomfortable. So, no, we'll leave the legs alone for now.
Okay, but walk her every day?
The hand walking is fine, especially because she does live outdoors, so it's not like she's on rest. So this ground is a nicer ground than what she'll have outside right now. So I would probably limit it to maybe 5 minutes. And then let me know if you are getting your vet out and schedule that in, and I'll try to attend and then help you guys go forward from there.
Okay. So somebody else also suggested backing her up.
No,
like
no,
the chiro did,
she's
actually.
not ready at all. That is like, it's one of the things that I highly disagree with the chiropractors recommending right away. Like, for all we know, she could have a fracture. Like, we don't know because nothing's been internally looked at. So that is, we're months away from even backing up a step. And when I do incorporate the backup into a horse's program, it's not straight. It's take 1 step and move the hip to the side so that they're not backing up onto the back joint. Like when you back a horse straight up, it loads this joint up with pressure as they tuck the pelvis underneath and start to move back. So when I first teach a horse, all I want to do is move the hip to the side, and that engages all of these muscles. So I'm asking the muscles to work first before the joints, so that when we do start going straight, the joints have the support from the muscles around them. But no, she's very far away from being ready to do that.
Alrighty.
And I would probably stay away from the poles for now. Normally, if I am assigning some rehab work, I'll assign some like poles, maybe 18 inches high that she can pick up and walk over. But I'd rather her get cleared by a vet before we even do that.
Okay.
Yeah.
Good enough.
Yeah.